Hello everyone, it's Dr. Dave. Hopefully you're all doing well. You had a nice weekend and or a good Monday to start your week. Of course, in Canada, hopefully you enjoyed a good long weekend and spent some time with family and or yourself just enjoying what you love to do. And it's Tuesday. We're back at it, coming at you on behalf of the Toronto Neck and Back Pain Clinic with your daily health update for Tuesday, May 25th. 2021. Going to look at 6 areas of health and wellness somewhere around this video. You can read through all 6 areas on your own, and if you'd like a copy or you have any questions after reading them or listening to us today, reach out to us, DM us on social, give us a call at the clinic, send us an email. We'll be sure to answer your question and or get a copy of that for you so you can have it. All right, not going to treat, diagnose, prevent, or cure any illness or disease with our time together today. However, we will continue to share with you 4 days a week in a video format, 3 days this week, a little bit shorter, but then at least 1 day a week on Fridays we'll also give you a written format. So 5 days a week we've got you covered, so you can stay plugged into some good information about health and wellness to stimulate your own thoughts, decisions, and actions each day to support how it is you'd like to take care of yourself and those around you, because it's always time, effort, and money well spent. So according to the American College of Cardiology, May 2021, an interesting correlation between having heart disease and a spouse having heart disease, that heart disease risk doubles if a spouse actually already has heart disease. They did a survey of 5,000 married couples, and it revealed that having a spouse with heart disease doubles one's risk for also having heart disease. The researchers note that lifestyle plays a large role in heart disease risk, and couples tend to have similar exposure to air pollution, dietary habits, and physical activity levels. So again, taking care of yourself could be a great way to help take care of those around you just by setting an example. The mood and the tone and the habits and things that we see and we engage in, others around us may be supported by those efforts, and that's how we take care of each other. The British Medical Journal Open, May 2021, looked at adults not eating enough omega-3. Data from the National Health and Nutrition Examination Survey suggests that 68% of adults do not consume enough omega-3 fatty acids, according to Dietary Guidelines. The Dietary Guidelines for Americans recommends consuming 250 milligrams of omega fatty 3 acids per day. So different food sources, of course, those healthy fatty fish, and there are some other nut and seed sources for omega-3s, but of course a supplement may help complement your diet to get those omega-3 levels in each day as well. The International Journal of Clinical Practice, May 2021, looked at exercise and how it improves mobility in seniors. They did an experiment that included 125 elderly, sedentary women. Those who started a home-based exercise program experienced significant improvements in functional mobility. And you want to stay mobile so you can keep creating those great experiences through life even later on. So exercise, a good component, a fundamental to our health and wellness. Good to keep that strong throughout our life from early on until as long as possible. Many teens have suffered a concussion, according to the Journal of the American Medical Association. 53,000 middle and high school students revealed in a survey that 24.6% of them had experienced at least one concussion, up from 19.5% just 5 years previously. So good to watch and be careful in those situations, especially contact sports, and to have proper assessment and follow-up for those, but also other accidents and injuries where someone could have experienced head trauma. You want to be sure you have a proper assessment and time to heal from those concussions. The American Academy of Dermatology has a good report here on people not understanding the cancer risk of UV rays as we head into the summer. They did a survey of 1,000 participants. 53% of them did not realize that shade offers protection from dangerous UV rays. 47% incorrectly thought that a base tan can prevent sunburns or were unsure. 35% believe that tanning is safe as long as you don't burn, or they were unsure whether or not that was true. And 31% were unaware that tanning can cause skin cancer. These findings surprised the researchers, and it demonstrates that a misperception about skin cancer and sun exposure is still prevalent. Dermatologists who see firsthand the impact that skin cancer, including melanoma, the deadliest form of skin cancer, has on our patients and their families, their patients and their families. It's concerning to see that so many individuals still do not understand how to protect themselves from ultraviolet exposure. Of course, providing sunscreen and sunblock is one method, but also trying to avoid especially peak hours of sunshine, staying in the shade, or wearing appropriate clothing to protect yourself. Always a good idea. All right. BMC Musculoskeletal Disorders, April 2021, looked at joint hypermobility and shoulder pain. Analysis of data from 6 studies revealed that athletes with hypermobile joints may be up to 3 times more likely to experience a shoulder injury than those with normal joint function. Good to have that joint function assessed by a qualified healthcare provider so you could find out if you have restrictions, dysfunction, and or hypermobility that requires some increased in stabilization and or learning movement patterns to support your level of function or dysfunction. Always a great idea. There's help out there so you can feel good, move around well each day, and enjoy yourself for a long time. We're happy to provide some of that information on the Daily Health Update for you. Hope you enjoyed it. We'll catch up with you tomorrow, middle of the week, Wednesday, with your next Daily Health Update. Have a great day. Share some smiles. Take care of yourself. We'll talk to you soon.